Well, we're going to give you an example of how you can evaluate your horse at home so that you've got a better sense of what your horse's actual top line is. This mare looks pretty normal compared to most people's horses, but I know I can see right through here that there's some tension. But so that you can train yourself to see it, I'm going to use a simple tool, just a straight stick, and I'm going to place this on the top of her withers and on the top of her pelvis here. Wow. It's just ever so slightly downhill, but notice the negative space in here. That is what you're trying to fit with your saddle and your pad. You ask yourself, is that normal? This is probably what I see on most horses, but I'm going to tell you that that's not quite as good as it could be. For a 16-year-old mare who's had good care but not massage therapy or chiropractic, other alternative therapies, she looks pretty good. But I'm telling you, she's still at a little bit of a negative posture. She can look better. Many of you have seen your veterinarian, chiropractor, massage therapist do a butt tuck so that the horse can put their pelvis back to a positive angle, and that is where her back can be. Some horses also need the help of a belly lift to further bring up the back side of the shoulder blade. This is the horse I want to bring back. That puts her pelvis into a positive, coiling, pushing angle and puts the push back into the deep hip muscles, stifle and hock, and takes the pressure off the low back. When a horse is in this negative posture, we will have pain from behind the shoulder blades. It's a tension pain through the mid-back and up through the low back and into the glute muscles. Many horses will have a tense shoulder and a tense low back. Most people have seen a palpation where a vet, a chiropractor, will draw 3 consecutive lines of pressure down the horse's back. They start with a light, a medium, and a deeper pass so that the horse can get used to the pressure, and then you can evaluate what that horse is doing. Fancy has some flinching right here. With a squeeze, and you can see a drop in her back, that is indicative of excessive tension in the long back and the shoulder muscles. I'm going to step to the back, and one of the ways that I instruct people to palpate their horses is from the opposite side. The heel of my hand goes into the withers. My fingers come down and press into the shoulder and long back muscles, and I'm going to push down and then pull up. We have a lot of flinching. She arches her back and she is dropped even further. I'm going to take our stick, and that is what happens with poor saddle fit. See how deep our space has now become? This is a horse responding here to a bad saddle fit. They hollow here, and from the hollowing, they tense the middle of their back, and then the low back becomes very painful, and now the pelvis is at nearly straight angle. We want that pelvis deep. That is the positive posture. We'll just back her up and do that again. We have the negative posture, and now the positive posture. So it's quite a difference. And your pad has helped keep her from getting worse. But what she carries through here started when she was probably 2. And you can put a horse out in the pasture and let them rest. A lot of people do it. They'll ride their season, pull shoes, and kick their horse out for the winter. Whatever problem you had when you quit that fall, it might subside a little bit with some rest, but when you have physical spasms in the tissue, which I can feel, she has physical knots, they don't go away with rest. Rest is the enemy of a muscle problem. So when you come back in spring, it will take even less time for whatever performance problems you had the previous season to come right back and haunt you. And you think, well, I let my horse rest all year. How did that happen? So what I want to help people with is that a pad, a saddle, a girth, a bit, they can enhance your performance, but they are not magic bullets. That you have to consider the structure of your animal and the well-being and the health of your animal and think about it a little differently. Muscle spasms can have some relief from chiropractic, but generally when muscle spasms occur further away from the spine, I don't generally feel that chiropractic is the sole solution for that. Chiropractics can free the spine, can free the neurologic system, and then some kind of stretch and tissue work with proper equipment fit can clear your problem the rest of the way. And that is given that you've already sought veterinary advice, that your shoeing and your joints and everything else with the health of your horse is cleared by your vet. But being able to see your horse for what it really is. Do I have a negative posture? And you can see what she does when I push there. She's like, hey lady, that hurts. Pay attention to what your horse is telling you. So, does that add up to how she's been?
Yeah. When she was a youngster, she was really, she was tough, because I actually even traveled with the third horse a lot of times, just because I knew on the third day she was going to be so sore, she was down, and it was easier not to argue with her. So it absolutely does, but it makes me feel horrible, because I never really thought that something I did when she was a youngster, between the age of 2 and 6, we were buying every pad that was out there, and I was always looking for the best saddle pad. And to think that I did a lot of this damage, and it's just been there for the last 10 years, and I was not educated about it. I so appreciate what you're sharing with me today.
These problems up here can cause horses to appear lame. And lameness has many causes. Most of us tend to think of lameness as inarticular or a joint problem or a shoeing and a foot problem, but it is multifaceted. Just as I explained earlier on, that we're looking at all the percentages that add up to a total lack of performance, all those things can also equate to muscular lamenesses and lamenesses from improper saddle fit. Fancy agrees. She just gave us a big sigh. So where we'll take you next is, all right, we've identified that we have some issues. We're going to show you a couple of different conformations in horses, white spots that have occurred from improper saddle fit, and then offer you some solutions on how you might look at padding and saddling your horse.